Just yesterday, Arizona added more than 2,000 confirmed cases of infection of COVID-19 to the totals. We now stand at 265,163 COVID cases since January. We'll have an update from numbers from the Arizona Department of Health Services at 8:30. But this morning, we want to get an update from ASU on how the university is handling the pandemic and seeing it evolve. As of November 9th, the university had 36 total known positive cases among faculty and staff members and a reported 252 cases among students. So ASU's president, Dr. Michael Crow, is joining us this morning to get us caught up on the strategies that you see working and maybe where some changes are needed to be made. So good morning to you, Dr. Crow. How are you feeling right now as we see what feels to be a second wave? In some cases, people are saying a third wave.
Well, Olivia, good morning. We're still in our very intensive management mode for the virus. We are seeing a sort of moving along with the social spread. We're seeing some of that impacting folks in our student body, but our management techniques are working, daily health checks, testing, masking, social distancing. And so we're still managing things in a positive way, but it's going to require vigilance and diligence for everyone to make any kind of institution operate going forward. And right now we're able to do that.
I think the challenge is people have COVID fatigue, right? At all ages, in all sectors of our communities. And so maybe people are becoming more lax on following the protocols. So what challenges do administrators run into and faculty and those in the residence halls of enforcing the protocols that need to stay in place?
We're getting pretty good compliance from everybody. We're getting, very significant use of our daily health check, our randomized testing. We've accelerated from 1% of our population to 2%, and we should be doing that more broadly in the state. We should be expanding testing. This thing about COVID fatigue, you ought to get over that because COVID's not going anywhere. It's going to be here forever, even with the vaccine. What I mean by that is we're just going to have to learn to adjust to it. We're going to have enhanced testing. We're building fantastic new, unbelievably sophisticated and capable testing activities that will be ready in the spring, in addition to the saliva-based test that we have now. And by the way, we do provide our high-speed saliva-based test to the general public. And so that's a really important element of all of this.
Contact tracing seems to be the key element that so many epidemiologists say is critical to flattening the curve, to getting a handle on this. And here in Arizona, it feels like we've been very behind on that element of tackling COVID-19. In the university setting, that's got to be a bit more manageable. How can we look at what you're doing as a model?
So the key is the daily health check, and we have an app for that, the randomized testing, and we have the capability for that, and we need to expand that into Arizona. And then the testing of everyone that's symptomatic, and then doing contact tracing from that. If you're able to make those things happen and do your masking, you can manage the spread of this virus in a way where we can keep things working. If you don't do that, we won't be able to manage the spread. And so right now we keep thinking it's going to go away. It's not going to go away. We're going to have to be very vigilant, very diligent, and very focused here to make this work.
Dr. Crow, as we're approaching the holidays, a lot of questions about what will happen as maybe students travel back to family and then return to campus. So what is your advice, and is there any mandates or messages to the students?
We have a lot of messages going out. We're asking everybody to test before they go home. We've got that available for everybody. They'll come in. They won't be positive. If families are gathering for Thanksgiving and they need testing, they should take a look at the ASU COVID test site and work their way through the system. And so testing is going to be really important, and social gatherings should be very limited, even in this moment of Thanksgiving. I mean, it's tough, it's rough, it's hard on everybody, but it's the way that we have to go for now.
Dr. Michael Crow, thank you so much. We know you're so busy there at ASU, so we really appreciate your time and the update today.
Thank you, Olivia. Nice to see you.